Johnny.
Nzuri.
Eh, Mama mwingine ulivipi nyamata hapa tumko?
Today let us talk about goiter. It's a common problem among women. The last person you saw, I'm very sure, with goiter must have been a woman. So it's more common among women at a ratio of 1 to 8. So more women have this problem, mainly because it is actually related to hormonal problems in the body. So more women are more prone to goiter problems than men. When you talk about the gland, the thyroid gland is situated in front of the neck, below the voice box, and above the windpipe. That's why it is. It is like the wings of a butterfly. The thyroid gland produces two types of cells. We have the follicular cells and the parafollicular cells. So the follicular cells produce two types of hormones. We have the T4 and we have the T3. The parafollicular cells produce what we call calcitonin. This is a hormone that regulates how much calcium is to be sustained in the circulation. This we're talking about how much calcium will go into the bones or be removed from the bones, and how much calcium will be absorbed in the intestines after you have eaten foods that have calcium. How much of the calcium will be absorbed or be left to go through. And so it controls calcium levels, and even in the blood circulation, it controls how much calcium will be retained in the blood through the kidneys. So we know some calcium can pass through the urine, so it regulates that too. So we have said the follicular cells produce thyroid hormone, which are two types. We have the T3 and the T4. So these two hormones are very important. When they are there, they regulate many things in the body, like they manage your weight, make sure that the fats are converted into energy or stored. So it manages your weight. It also manages how fast your hair, nail, or your general growth takes place. So it makes sure that you grow perfectly. And then it controls metabolism. That's where your weight comes in. It also makes sure that your internal temperature is perfect. It makes sure your body temperature is right. And then it also manages your energy levels. Parafollicular cells produce parathyroid hormones. We have talked about it. It is calcitonin. So calcitonin is produced from these cells, and its function of calcitonin is to make sure calcium is regulated and controlled in the body. Otherwise, you will have poor bones or poor bone health. So we have two abnormalities that comes from thyroid problems. We have hyperthyroidism and hypothyroidism. Hyperthyroidism is when the gland has become too large, and it presents as heat intolerance, tremor, palpitations, anxiety, weight loss, increased bowel movement, shortness of breath. And if it goes on, if it is that large, of course it will, the grown thyroid gland will compress on the surrounding structures, leading to difficulty in breathing, swallowing, and if it's so large, it can block the carotid artery, the blood vessel that brings blood to the brain. So it blocks it, and so you, of course, will start developing signs like dizziness. Other problems that come from hyperthyroidism will include blood clots, stroke, and heart failure. Of course, these are related to cholesterol. So it means that your body cannot remove cholesterol from the veins, and it will develop into something else. And it can also press on the nerves that lead to the eye, therefore developing things like double vision. You'll have double vision, light sensitivity, and the nerve that is pressed, if pressed, the problem is called ophthalmopathy. Hypothyroidism happens when there is too little thyroid being produced. So there is a problem that's the opposite of hyperthyroidism. So it will present as, it can lead to cholesterol levels and heart problems. So the cholesterol increases too much and you'll have heart problems. This is because metabolism has slowed down. The hormone that is supposed to regulate metabolism is not there, so you will develop too much cholesterol in the blood. So this presents as tiredness, more sensitivity to cold, constipations, dry skin, weight gain, puffy face, hoarse voice. That's why women at some particular age, their voice break, they start speaking in a deeper voice. Muscle weakness, muscle aches, menstrual problems, slow heart rate, which is also called bradycardia, memory problems, and depression. Hyperthyroidism can also happen to babies. Also, it happens in all ages. To babies, it will represent as feeding problems, poor growth, and weight gain. So their weight will come up very slowly. Yellow skin, poor muscle tone, enlarged tongue, swelling near the belly button. Those are the symptoms that we'll see. In teenagers, hypothyroidism presents like slow mental power, poor mental power, and delayed puberty. So what causes goiter? So if you have goiter, don't eat some foods. These foods have what we call, they are what we call goitrogenic foods. Remember, hormones that come from the thyroid gland, they are mixed with iodine. So anything that will interfere with the production of the hormones, because part of the hormone is iodine, anything that blocks combination of iodine to this hormone will cause goiter development. So these foods contain some substances that interfere with combination of the iodine to the other part of the hormone. The body tries to rectify this problem by ensuring that the gland now grows larger, so that when it is larger, it produces more hormone. But if there is no combination of iodine and the hormone, then there's nothing being done there. So we'll start with medication. Some medication that try to regulate the speed of the heart also interfere with production of the hormones in the thyroid gland. So some medication like those ones are dangerous. Then we have bromides from plastics. Bromides are in plastic. So if you have thyroid and using utensils that are plastic, then you are actually worsening the situation. Then bromides are also in pesticides. So basically, if you have goiter, don't eat these foods. We have cassava, linseed, sorghum, sweet potatoes. These contain what we call thiocyanate, which competes with iodine for thyroidal uptake. Then we have the second class is the cabbage, kale, broccoli. These contain glucosinolates, which competes with iodine during uptake. Then we have the third class is soy, millet, which contain flavonoids, which impair thyroid peroxidase activity. Then we have the fourth class is cabbage, sprouts, Brussels, which have goitrin, which reduce production of thyroid hormone. Then do not smoke, because when you smoke, you are taking in thiocyanate, which competes with iodine during uptake. Then lithium, when a cell phone battery has gone bad, you will see there is some smell, a very sweet smell. So that is lithium oxide. Do not smell that, because you are taking in lithium. And this also interferes with uptake of iodine. So let us see what else we can talk about, things that can help you. I have medication for this. If you take this medication, this herbal medicine, it actually regulates, controls, and helps the goiter to shrink back. Most people say you go and do operation, but ask many people who have done operation, and it's very expensive operation, you realize that it comes back. The best way to stop goiter is you treat it internally with the medication, herbal medication, and it shrinks and shrinks permanently. This herbal prep contains myricetin, quercetin, rutin, selenium, and other compounds which are perfect in treating goiter. Listen to one of the ladies that I treated goiter. Hello.
Yo, daktari. Hello.
Hey.
Habari ya jioni.
Nzuri.
Mama mwingine ulivipi Nyamata hapa Kivuko? Nahitaji kutuma wagonjwa wengi sana, si kama mmewapata wengine kutoka Kiumbu wawili.
Wewe uko Nyamata? Kuna mtu
wagonjwa. Kama wanakupata.
Siwezi nikajua kwa sababu kuna watu wananipigia kutoka Kisumu, Kiumbu, Kisii vile wasema Keroka, hata sijui ni kama hao.
Nilipeana Kiumbu Keroka. Kuna mwingine nikapeana na wengine Nyamata hapa wawili. Si kama wamekupata.
Kuna Nyamata nimepigiwa simu leo. Lakini nikamwambia maybe Thursday, lakini
kuna mwingine alitaka ukuje, mwenye alikupigia Friday akaniambia anataka ukuje mpaka Nyamata.
Normally when I treat somebody, they always give my number to somebody else. Like this lady who had struggled for so long with goiter.
Hata kuna mwingine nilipea hiyo namba leo. Ndio nataka kujua kama utakuta pia tena nikipata. Hata wakiomba wanasema si wakupata hapa Nyamata ama.
The conversations are always very long, so yes, this is part of the kind of conversation that I usually have with my customers.